Earlier this week, the UN Secretary-General Antonio Guterres said that, I quote, "The situation in Ethiopia is spiraling out of control. The social fabric is being ripped apart and civilians are paying a horrific price. Hostilities in Tigray must end now, including the immediate withdrawal and disengagement of Eritrean armed forces from Ethiopia." End of quote. The United Nations Human Rights Office has received reports of civilian casualties and destruction of civilian objects due to airstrikes and artillery strikes. Indiscriminate attacks or attacks that deliberately target civilians or civilian objects amount to war crimes. There is no other situation globally in which 6 million people have been kept under siege for almost 2 years. Banking, fuel, food, electricity, and healthcare are being used as weapons of war. Even people who have money are starving because they can't access their bank for 2 years. Children are dying every day from malnutrition. There are no services for tuberculosis, HIV, diabetes, hypertension, and more. Those diseases which are treatable elsewhere are now a death sentence in Tigray. Yes, I'm from Tigray, and yes, this affects me personally. But my job is to draw the world's attention to crises that threaten the health of people wherever they are. This is a health crisis for 6 million people, and the world is not paying enough attention. I urge the international community and the media to give this crisis the attention it deserves. There is a very narrow window now to prevent genocide.